Today I will be discussing about the topic of blood reports, which we generally analyze and find out that how it can help us in dietary management. Here we will be learning particularly in the aspect of type 2 diabetes patients. So like we know that while I talk about diabetes, so it is a varied aspect. There is no fixed reason for which diabetes may happen. There can be genetic, epigenetic, hormonal factors which all together will lead to the disorder, which means that there as a whole is no one reason for which diabetes is occurring. But for every case of diabetes, one thing is common, which is the high blood glucose levels. Now, these blood glucose levels, they can be because of various reasons. Like one, of course, is the dietary intake. Other than that, there can be gluconeogenesis. Like we know that the hepatic system will produce excessive glucose, and that is how the blood glucose rises. Many times, glucose insufficiency or insulin insufficiency because of the pancreatic functioning can also lead to high blood glucose. And at the same point of time, the very important insulin resistance, one very prominent reason behind type 2 diabetes is, of course, there, where the cells, particularly the skeletal muscle cells, they don't respond to the insulin activity. So all these reasons together may affect the blood glucose levels. Now, while we discuss about the nutritional assessment, we all know that these are the basic steps that are to be followed, that is A, B, C, D. Where B, the biochemical assessment gives us a clear idea, a clear understanding of how the body metabolic system is working. And this could be a signal for us to understand and manage things in a better way. Now, there are multiple tests which are present, out of which we will be taking few. So let's start with the postprandial glucose management. Now, we know that after the meal, if the body cannot manage the excessive glucose, then definitely the glucose will rise. Now, that can be surely done by cutting down carbs, by adding fibers and protein, portion controlling, and stimulating physical activities. These are the very promising ways of controlling the postprandial glucose. Food sequencing and meal response, these two concepts which also work along with the food that we are eating can be included here. Adding a good amount of fiber at the very beginning will surely lower down the glucose release from the body. At the same point of time, meal response is believed to be another method which keep on reducing or managing the blood glucose levels. The chronological nutritional concept, where we know that the food can be served as per the biological clock, is again a very important way of cutting down the postprandial glucose levels. We all are aware of the alpha glucosidase inhibitors drugs, and we know that these drugs, they work wonderfully by slowing down or reducing the activity of particularly amylase enzyme. Now, we can get almost the same working capabilities with some of our dietary approaches as well. Like we're aware of galactomannan, which is of course a carbohydrate, a gel formation carbohydrate, but then this can bind to the enzyme, the alpha glucosidase enzyme, which is responsible for the digestion of starch. So a dietary intake of galactomannan can surely reduce the glucose release and glucose spike in the body. Corosoric acid is again a very important and now a newly known acid, which is mostly found in banana leaves, but then also present in banana flour. And that also shows this type of activities. So we must be aware that there are few certain biomolecules which have this natural alpha glucosidase inhibitor activities, which we can surely include in our diet. Okra and fenugreek seeds are, of course, such few molecules which are generally used nowadays in order to cut down the glucose surge. The next test that I will be covering here is the fasting glucose. Now, we all are aware that for diabetic patient particularly, fasting glucose is always on a higher side. Now, the reason behind this fasting glucose is mostly the gluconeogenesis. In the night hours, when the body is asleep, during that time, the body will produce certain hormones. These hormones are glucagon, they are cortisol, they are epinephrine, and growth hormone. And together, these hormones, they reduce the activity of insulin and they push the glucose in our blood. Now, that is a natural phenomenon, so we cannot do much about it. But for a diabetic patient, this can be really lethal. So we can find out ways by which we can ensure that at least these counter-reacting hormones which are surging at the dawn, we can somehow control it. So insulin is one such hormone which can help us to balance these counter-reacting hormones. So what do we do? In case of a high fasting blood glucose level, we can go for balanced evening meals, where addition of fiber and a protein along with healthy carbs can make sure that there will be slow release of glucose. With the slow release of glucose, there will be a slow and a steady release of insulin for a longer duration of time. And as a result of which, the other hormones like glucagon and growth and cortisol hormone, they won't push the glucose in our blood. So a nighttime snacks, including a combination of protein and fiber, can help us to cut down or to curb down the glucose surge in the early morning hours. Now let's come to the twin cycle before I head towards the next test. Now this cycle, it tells about the relation between the liver and the pancreas. Now, like we are aware that liver is always responsible for managing glucose as well as fat. On the other side, we are even aware about the pancreatic system, which is responsible for the release of insulin. Now, these two particular glands are very, very important in order to manage our glucose homeostasis. Now, it is being noted that whenever there is a rise in glucose, that excess glucose will go to liver, it will turn into fat, particularly VLDL and triglyceride. And these fat will cause lipotoxicity to the pancreatic cells and thus entering into the condition of glucose stimulation reduction, or we also call it as the insulin resistance. So the link between these two is fat and insulin. Now, in order to understand that and measure that, we can surely go for triglyceride level. Whenever in our diet the glucose values are increasing, this excess glucose will turn into triglyceride. And at the same point of time, other than glucose, fructose can do the same and also at a very higher and a faster rate because of its faster rate of diffusion. So we end up getting triglyceride excess in the liver, which ultimately again affect the pancreas to reduce the insulin response. So what we can do for these conditions, if a particular condition is there that a person is having high levels of TG, maybe the person is not yet diabetic but pre-diabetic, but the person is also showing insulin resistance symptoms, so we can definitely cut down the glucose. Now, cutting down glucose is of course a big task. Of course, a big task here. So we can choose over amylose.
Sorry, Vijaya. Anmol, can you please mute yourself? Anmol, Shimanti also. Yeah.
Okay. So like I was discussing that while choosing the carb or the starch, we can choose wisely. Like we have options of amylose and amylopectin. So we can surely go for carbohydrates which have more amount of amylose because the degradation and the release of glucose will be less in comparison to amylopectin. Insulin resistance test, which is mostly done by the fasting insulin levels, is also a very important assessment because it gives us a clear understanding that how our body is interacting with insulin, whether our muscles, our tissues, our cells, particularly skeletal muscles, are using it or not. So we must know that insulin resistance is because of GLUT exposure, that is glucose transporter 4, which is a transporter which allows glucose in the muscle. Now, whenever there is glucose present in the body, but then insulin is not working, insulin receptors are not doing the response correctly. So that is when we call it as insulin resistance. So in case of insulin resistance, we can choose those options which will promote and enhance the GLUT4 expression because they are responsible for glucose uptake. So such dietary molecules can help us make the task easy, like polyphenols. And we know that polyphenols not only help in GLUT expression, but they also help in controlling the gluconeogenic processes. Cinnamon and other spices like turmeric and ginger, they are also believed to be important in terms of GLUT4 expression. But just to assure you that these dietary approaches won't work alone because when we are talking about muscle, then muscle stimulation becomes very important, and that can only be done by physical activity or exercises, particularly high intensity exercises. The next test that we will be talking here is C-peptide test. Now, this is a peptide which is released as a byproduct whenever the body produces insulin. So we can understand that how much insulin the pancreas is producing. So basically, if the C-peptide values are less, then we can be sure that the pancreatic cells are not releasing the insulin or secreting the desired amount of insulin. Now, here comes the role of calcium. So before we understand calcium, let us know that the pancreatic cells, they release insulin in response to the calcium concentration in our body. So it may happen that due to imbalance of vitamin D and calcium, the pancreatic cells are not releasing the insulin as per needed. Calmodulin is another important protein which helps in this signaling, which is also stimulated by calcium. So levels of calcium and vitamin D make sure that the pancreas is producing and releasing the insulin rightly. As because the person is having less insulin in the body, so we definitely have to reduce the carb portion. So we can manage by giving very, very small quantities of carb after a small while, which the available amount of insulin can use. Here we have to be very smart and we have to make sure that the person does not crave for glucose or sweets. So we have to keep in mind that we can do that by adding tryptophan. Tryptophan, like we're aware, that it ends up by converting into serotonin, which again, being a neurotransmitter molecule, will not only curb down our carbohydrate craving, but also make sure that our sleep cycles are good. And that is also needed to balance down the dawn phenomenon, which we have discussed. Now, one very good source of tryptophan, of course, it is the animal sources like egg and meat. But other than that, pumpkin seeds are believed to be one wonderful source of tryptophan. Now, as because we are talking about diabetes, it is very important to understand that what a body can experience when there is high glucose level throughout. So if a body is exposed to high glucose, high calorie for a while, then this will activate some of the nutrigenetic factor. Like one such important factor or gene will be apolipoprotein gene. Now, whenever the body exposes to high amount of glucose, the ApoB100 gene expression increases. Now, this particular gene produces a protein, which is ApoB100, and that protein is responsible for synthesis of LDL and VLDL. So ultimately, the body enters into a atherogenic phase. And here, this will lead to atherosclerosis. So it becomes very important to understand that if somebody is having a apolipoprotein lipid values where the ApoB100 is high, so here we need to make sure that we either cut down the carbohydrate and also we make sure that some other sources like berries and peanut can be added, which have nutraceutical values to lower down the LDL and VLDL level. Now coming to HbA1c. So HbA1c, we all are aware that this is a very significant data which gives us understanding that how the body reacted in the last 3 months, what was the glucose status. We also have to understand that there might be certain controversies with HbA1c. Like one can be anemia. People suffering with anemia or hemoglobinopathies won't be giving the right or misleading values will be there. So there is another method of assessing the same thing, which is the glycated albumin. Now, while I talk about glycated hemoglobin or albumin, the thing remains the same. In both the cases, glycation is happening. And glycation is happening because of the higher levels of glucose. Now, it is said that this glycation, while the glucose is getting added particularly to the protein, it happens mostly when the cells are already damaged. Like we are aware that in our body, there is oxidative stress which is always there. That can be low, but that can be high as well. So in that condition, in that high oxidative stress, the cells, the tissues are already degraded and the proteins are somehow exposed, for which the process of glycation can be very fast, it can be very quick, and thus the damaging can be terrible. So what we can do is we can understand that if somebody is having a HbA1c higher level, then surely the body is suffering with a higher oxidative stress as well. So we can not only cut down the glucose, but also we must make sure that the oxidative stress is reduced. And we can surely do that by managing or by promoting the antioxidants. So by promoting the antioxidants, we will cut down and we will reduce the rate of glycation. Now, for diabetic patient, the major problem that we always face lies with the different micro and macrovascular disorders. Like there are issues with neuropathy, retinopathy, kidney diseases are there. Now, in all of these cases, like we know, the common problem is high level of glucose. So if there is high glucose, there will be high glycation, correct? But at the same point, just now we have learned that if we somehow manage to lower down the oxidative stress, then the rate of glycation is automatically controlled. So if a person is hyperglycemic, then we must take care of the oxidative stress. We can add the various forms of and antioxidants which will make sure and which will reduce the glycation. Now, this AGE, which we are always scared of, this AGE can be dietary. Also, it can be regulated by the action of polyphenols, polysaccharides, vitamins, and alkaloids. Now, there are multiple options. Now, we have to be aware that while we talk about tissue damaging, then here the tissue damaging always occurs on the surface proteins. Now, in that context, there can be multiple antioxidants which are available, but out of which glutathione is one such antioxidant which plays a vital role in reducing the glycation as well as the oxidation on the surface proteins. So this glutathione itself is produced by the body, or we can obtain it from some form of supplement as well. But as because the body is capable of producing it, so we can stick to it unless and until we have the other things available. Like a glutathione will work only when there is vitamin C. At the same point of time, vitamin C will give response only when there is availability of vitamin E. So many a times we think that addition of antioxidants can help the person, but we do have to understand that these antioxidants, they always work in a set. So if I'm choosing vitamin C, I have to be aware that I must choose vitamin E as well to make sure that it is working fine. So all as a whole, this entire set can be administered to people who are suffering with hyper level of glycation, and we can cut down or reduce the HbA1c level. Now, this is all that I wanted to discuss. If we have any questions, I'm open to it.